Welcome to another episode of Dr. Rob, Pain Detective. I'm your host, Dr. Robert Pomahawk, where we bring guests on that are suffering with chronic pain and provide them with evidence-based solutions. On today's episode, we have Majik, current IMBA World Professional Fitness Champion, a personal trainer, a performing artist, a singer, a dancer, and a model. I want to introduce my guest, Majik. Thank you for being here. I appreciate it.
Thank you so much for having me.
So today we're going to discuss your current state of health, how you got to be a fitness model and your endeavors and things that's going on in your life, and why we're here to improve your overall fitness.
Let's do it.
Yeah. So tell me a little bit about your past, how you got into fitness.
Okay. Well, I started as a dancer and then I was always into acrobatics. So I was doing flips and splits since I was 7 years old, back handsprings, back tucks, back flips, all of that. And then I was a cheerleader going into middle school and high school. So continuing on with my acrobatics, and then come after college, I got more into yoga. Kind of got bored of that and went into more personal training, more like heavy weightlifting, and then wanted to challenge myself a little bit more and started doing bodybuilding and got into bodybuilding competitions.
Did you ever have any serious injuries that you can recall when you were little?
Definitely have some weak ankles. Definitely have twisted my ankle a few times doing some acrobatics.
So you've had some traumas from such competitive sports and such high impact sports.
Yeah.
So quite interesting that your background matches your current posture and matches the structural pathology that we're going to see in your x-rays. Even though you have a history of muscular development, that you're able to get to the upper echelons of a very competitive world in professional bodybuilding, and how much competition there is, and the fact that you won one, pretty impressive. And somehow you steal the show?
Yeah.
What was that like?
Funny.
Yeah, I can imagine.
It was funny. I mean, I showed up, the first week was in Culver City, and that was the amateur show.
Yeah, I've been to that one.
Yeah. So that's where I qualified as professional, and all of the judges just convinced me, come next week to Vegas, compete as a pro. And I'm like, I'm a pro now, I guess, so I'll go. And, I showed up. I pulled out all of my gymnastics routine.
Wow.
And my yoga. I combined yoga and gymnastics.
Came back to be helpful, right?
I came back around. I still, after all these years, can do my back handsprings and my flips, and pulled them out on stage and won. Then the next step would be me wanting to compete in not necessarily the INBA, but the World Bikini Fitness and Fashion for women.
So the first piece of the puzzle that we look at are the 4 pillars of pain: muscle degeneration. Then there's a potential of nerve degeneration. Then your spine plays a major role, and then so does soft tissue. So those are the 4 pillars of pain. Again, what we do in the office is we're not going to teach you how to exercise because you already know how to do that. What we do is provide you with specific postural exercises based upon your x-rays, which we haven't analyzed yet, and your postural faults. What do you think?
Sounds pretty cool. I mean, I've always just been working out to gain muscle, but never really aware of, these things. And it's funny because I used to always get made fun of in middle school because people say why are you walking around like this? Like, trying to make your boobs look bigger. I'm like, I have no boobs. Like, leave me alone. But I guess I would always walk around like this or something, like with my back, like my chest always forward. And so I don't know.
Yeah.
So I don't know if that's
that posture's probably been around for a long time, right? Ever since you're in grade school.
Yeah, it's always been like something like this, But I got a massage the other day, and the lady was like, "Oh my God, your shoulders, and my neck especially, even when she touched it, I was like, oh, ow."
So one thing that we teach here is not just what's happening now, but how you prevent things from breaking down in the future. So the next thing that we look at here is going to be your nervous system. We provide you something called the core score. Okay, it's your body's ability to handle stress neurologically. In your situation, you did a pretty awesome job handling your stress.
Okay.
So congratulations. The therapy for nerve inflammation is either a chiropractic adjustment or acupuncture. They both work very similarly to take the pressure off the nervous system.
Can I get both?
Yeah.
Yeah.
What do you think about that?
Both.
Right?
Let's do it all.
The other nervous system that we evaluated that we haven't looked at yet is your organ dysfunction. So you see all those reds over there?
Yeah.
Well, red at C1 indicates that you're having extra pressure on these different parts that are highlighted in blue.
Okay.
So brain dysfunction.
Yeah.
Then we come down to the lower part of your system over here. And same thing over here. Now we're getting to the neck and the shoulders. We're getting to the throat, sleep apnea, sleeping issues, right? So how do we analyze these things? The way we do that is by setting up a consultation with our medical doctor, our cellular specialist, Dr. Mike. Not my area of expertise. He's been studying internal medicine for over 30 years.
Wow.
Right? Imagine what he can do for you. So the last piece of the puzzle that we look at is going to be your x-rays. And this is what I specialize in. I specialize in spine pathology and ligament damage. So what we did here is we analyzed your structural system, not because you're having pains per se. We wanted to kind of see what's going on inside your body and how that correlates with muscular improvement or symptoms you might be having after your workouts, or why certain muscles just aren't developing.
Right.
Look at your jaw in your picture compared to the jaw in the left-hand picture. You're looking down, right?
Yeah.
You're becoming that old person already.
No.
So stop doing that. You see that number right there? Can you read it for me?
100%.
100.
Overall loss? The hell?
Yeah. You have 100% loss of curve in your neck.
Jesus.
Yeah. 0.
Is that why my neck is so messed up?
Well, one of the factors, one of the other factors your head was in a forward position.
Is it because I'm texting all the time?
That doesn't help. So how are we going to text now? Up here, right?
Don't text anymore.
Don't bring your head. Yeah. Well, we can't do that, but what we can do is bring our head to our hand, not our hand up here, right? That's what we want to do. We want to focus on bringing things to us.
I'm like this all the time.
Yeah. So stop that and
I'm
see what
constantly
happens.
like this.
Now, how does this play a role when it comes to muscular performance? Heard of disc herniations before?
Yeah.
Pinched nerve?
Yeah.
That all happens because of added additional loading of the bones onto the disc and onto the nerve because of your loss of curve. But if your bone structure is putting pressure on the nerve, those muscles can't fire at their optimal level. So you can't develop the muscular system you want because they're just not going to get there. We have to bring this red line to this green line. Bring that spine forward and pull this back. The way we do that is by doing something called spinal correction therapy. It's like crooked teeth, right? If you have crooked teeth, it doesn't matter how many times you brush them or floss them or use mouthwash, your teeth are still crooked because they're still crooked. So how do you improve crooked teeth? Braces, right? And braces take 2 years and another 2 years for retainer.
I have to wear a neck brace?
No, we don't want to wear a neck brace. We have to do spinal correction therapy to help bring the curve back in your system. We also had that disc being compromised. In order to fix that, what are we going to do? We got to do another type of treatment. It's called decompression therapy. In the office, we have decompression therapy for the compressed disc.
Sounds nice.
So what we'd like to do for you is offer you 2 months of care to get you prepared for your show in April. Why?
Okay.
Because I think I should be part of your team.
Okay.
So 2 months of care, and then after the 16 visits of all the things that we do here, we'll do a follow-up examination.
Okay.
We'll rescan your posture, your nervous system, your spinal system. We'll go over all that information to find out how much better those numbers got, because numbers don't lie.
Yeah.
Fair enough?
Yeah.
Welcome aboard.
Cool. Thank you.
Cool. So welcome back to the show. Today we had an amazing guest, Majik. She came in because she's a athlete, still a high-end athlete competing in bodybuilding competitions, has a history of being very active as a kid by doing gymnastics, dance, aerobatics, yoga, and now fitness training. So we wanted to kind of show her how to improve her inside to improve her performance when she's competing in her upcoming show. What we did is we evaluated how her muscles are playing a role, her posture. We found that her hands are in a forward position, rolling her shoulders forward, her neck is in a forward position, her knees are back, her hips are forward. She was all over the place. What we also discovered is that she's leaning to the right, adding more pressure to her right ankle, which is already a problem from injuries in the past, right knee pressure, right hip, which then she told me she's having slight hip issues and lower back problems, and she was dropping her shoulder. How do we fix that? By providing her with percussive therapy, a Theragun every time she's coming into the office, and then also mirror imaging exercises on a vibrational plate to help her understand how to find her posture so when she's in the gym, she's going to reduce the risk of injury and have a better workout. Then we analyzed her nervous system through surface EMG, central EMG, heart rate variability, and we found that her ability to handle stress isn't at its optimal level. Specifically, her muscles of her postural muscles. They were working way too much, especially in the lower part of the body. We provided a solution for that, which was chiropractic adjustment or acupuncture. And then finally, we analyzed her structural system. Her neck had a massive loss of curve. Her thoracic spine had a huge increase of curve. Her lower back was too much curve as well. Her tailbone was also too much curve. And then we also discovered she had degenerative disc disease. She's in her 20s. She's not supposed to have that at L5S1. Why is that happening? Probably her past. Small traumas over a long period of time. Adding the load abnormally to that disc is the main culprit behind why people get disc herniations, disc disease, disc degeneration. So how do we fix that? Decompression therapy, spinal correction therapy, helping with her posture, problem solutions. And then we also analyzed her neck in a state of flexion extension. And we discovered she's also having ligament damage. That has to be caused by some form of trauma. Slip and fall, falling on your head while she was doing her gymnastics. Maybe other factors like a small car accident. You're 40 times more likely to suffer with chronic pain of the neck because she has ligament damage. So what do we do with that? We get an MRI to look at ligament instabilities, disc degenerations of the neck and the lower back, give that information to our regenerative medicine expert, and then determine a plan with that. PRP, exosomes, stem cells. We figured it out. So the bottom line is we figured out what's actually happening in Majik's body and we provided her with a proof-driven treatment plan. And in 8 weeks, we'll come back on the show and see the improvements.